It's going to be a busy morning as we crisscross the country, not just for the analog switch off in the Free State, but also because it is, of course, V-Day, as one of the papers put it, and the second phase of our vaccination rollout. And as the country gets ready for the second phase of the COVID-19 vaccine rollout, the Eastern Cape says that more than 160,000 elderly people have in fact registered to receive the jab. Now, the province aims to vaccinate 770,000 elderly people by July. However, the department has raised concern around the projected third wave, which has already hit other provinces. So for more on this story, we cross now to our SABC reporter Lerato Fekisi, who is at the Duntan Park Lodge, which is a home for the elderly in Gqeberha. Lerato, good morning, and thanks for being up so early and as we track the story this morning. But please tell us what's happening where you're at and whether the elderly there are in high spirits. How are they feeling about receiving the jab today?
Absolutely, so excited. Like you said, we've been up since the early morning, and I wanted to just talk to them before we have the interview and find out exactly how they're feeling so that I don't put words in their mouth. But I think the good thing about these two, Sekina, is that they're both nurses, so it became a no-brainer that they're going to get the vaccine today, and I'll allow them to talk now for themselves and find out from them exactly how they are feeling. And you have actually registered. Let's just first talk through how the process of registration was online using your phone or computer, and then also why it was important for you to register for this vaccine.
Well, I'm fortunate that I have a laptop and a router, so I have internet, and I just used it. And my medical aid also advised me to register, communication with them regularly. And it was just a case of logging on and filling it out, and I received an SMS practically immediately to say that I have been registered. I'm still waiting for a reference number that we will get, but I'm confident that they will send me a reference number. It was easy.
Now, and we're talking earlier on that you ladies obviously stay with other people on the lodge, and obviously some people are just like, I don't want the vaccine for its own complications. You are saying that that's just hearsay, and perhaps these stereotypes that we see in social media now don't affect you because you feel it's important for you to get the vaccine despite what people are saying around you.
Yes, of course it's important. I don't really listen to conspiracy theories, and when you live in a community like this, there are bound to be rumours and all sorts of things circulating and so on, and I just don't take any notice of that. I listen to what my common sense tells me. My father lived through the 1918 pandemic without all this social media and news and what have you, so yes.
Interesting, 1980s. Oh, that's a long time ago. You weren't even born, you weren't even allowed then. Awesome, okay. Okay, now Jean, you are also a nurse, and you are saying to yourself, you know what, as a nurse, it's a no-brainer, you must get the vaccine. But also you're saying you are a bit anxious because it's not like we've heard about this vaccine before or we've done it before. So do you also, although you're going to register, do you also have some anxiety still a little bit concerning the vaccine? And what is your anxiety as a senior citizen?
I don't really think I've got any anxieties that worry me. I've heard of all the problems, especially having clots and that. I'm not fearful of that. I just feel it's important that you do have it to try and cut down on the spread of the virus. And, for people who don't understand, they need to look into it and find out what the problem is.
Okay, so you are saying that pretty much as much as you can, you are going to obviously advocate for those that don't want the vaccine to get it because it is important. Like you're saying, we're looking towards perhaps a third wave right now in the country. So you're saying because of that, the bigger picture and the bigger, most important things to get the vaccine.
Yes, it definitely is. I think people who don't know anything about it should actually take the trouble of going to a pharmacist and finding out, or to their doctor, and finding out what the side effects are before they say no to getting it.
And then lastly, Jean, when we were talking, you were saying that perhaps one of the reasons people don't know enough about it, especially if you think of people in the far-lying rural areas of the Eastern Cape, is that there hasn't been enough information around the vaccine, enough information about the side effects, especially for citizens who might have comorbidities. So do you think the government must do more in terms of education pamphlets or flyers to get the information out there to help people get rid of the fears?
Definitely. I actually feel that there should be some campaign on TV because most people watch TV today, especially SABC, and an educational program telling people the good side of it, not the bad side, not the effects, the side effects. And, especially in times like maybe Sentleeng asking them to bring it into one of their programs. Something like that would help.
Awesome, June. So as you hear, Sakina, some suggestions there that perhaps at the show of Sentleeng, if they are watching by any chance, if they could perhaps incorporate that into their TV program. But also the two ladies saying that more information needs to go out there, whether it's on SABC platforms, radio, TV, and also the Department of Health must perhaps hand out flyers to inform the citizens about this vaccine, and also to make sure that people don't have fear and anxiety surrounding it. So more information is the key to making sure that we get more people, more citizens to register for this vaccine. But for now, Sakina, let's go back to you in studio.
Well, thank you so much, Lerato, and interesting to hear the views there of those who will be receiving that jab today in Gqeberha in the Eastern Cape. Let's move now to the Northwest Province, where elderly people also will be taking that jab. They'll have to wait a little longer, though, to be vaccinated, as we understand. Now, this as the province still has many healthcare workers who've yet to be vaccinated. Our reporter, Sentleeng Lehihi, is on this story for us. Let's check in with her now to find out what's happening where she is. Sentleeng, good morning. So where exactly are you, and what's expected to happen there today?
Good morning to you and our viewers. We're here at the Rottera's Old Age Home in Mahikeng in the Northwest Province. We've seen quite a number of the residents here getting their registrations, excited about the possibility of also getting those much needed jabs to combat this COVID-19 pandemic. But as you mentioned in your intro, there'll be just a bit of a delay for residents here in this old age home. We understand from the Department of Health that only 5 vaccination sites will be activated in the province, being in Rustenburg, in Klerksdorp, the Potchefstroom area, and Brits, and activation and vaccinations at those sites will take place between 12 noon and 4 p.m. But here in Mahikeng, we only anticipate the vaccination sites to be opened from tomorrow on, including vaccination sites in Lichtenburg and Ventersdorp, as well as in the Vryburg area. We understand as well that so far only about 23,000 of the 44,000 registered healthcare workers have been vaccinated, and this has created much pressure for local authorities to ensure that the healthcare workers are actually done with before we can actually focus on ensuring that the over 60s are also getting these much needed jabs. We understand that so far just over 59,000 elderly people have been registered. But just to get more context, I'm going to ask Gretchen to tell us. Gretchen, how excited are you about the prospect of being vaccinated?
I'm very excited. I think it's high time. We waited a long time for this, with the numbers increasing day by day, and the situation in India. I'm very concerned, so I'm very optimistic. I'm not negative at all, and to all those negative people, I want to say God have given those people the knowledge.
Your situation is quite special as well, because you told me that you and your son are actually divided on this whole vaccination.
Yeah, my son is very negative. I tried to persuade him. He said it hasn't been tested enough, but I'm sure it has been tested enough. And I think it's quite safe. And as I understand, the side effects are much more less than it used to be.
Most certainly. Thank you very much for your time, Gretchen. Gretchen explaining there to us that she's extremely excited of the prospect of getting vaccinated, and she believes that those soothsayers who say that the vaccinations should not take place should actually, just go on with it. Elise, I see you sneaking off there. Just a word from you as management of the old age home. You're excited that nurses have been, going to be vaccinated, but some general staff are not.
Yes, that's a little bit of a concern for us, although we are very grateful for the vaccines. We just feel that the health of the residents and the staff working here is of paramount importance, because we are working closely together As a family here, we're supporting each other. So it's really very important that all the staff that's working here, I mean, the people who's arranging the food, who's doing the dishes, who's helping to make the beds, we are all interacting with the residents and with each other. So for me on that, I think it's absolutely important for everybody to be vaccinated.
Thank you, Elise. Ntate, just for the statistics, do we know how many of our residents here have been registered for their vaccines?
Yeah, we've got 25 residents. We've got 23 registered. It's exciting. It's more than 80% of the residents here, and we're quite excited. We cannot wait more. Yeah.
Thank you very much for your time, Ntate. From us here at the Rotaras Old Age Home in Mahikeng, back to you in studio.
Well, thank you so much, Sentleeng Lehihi. So there you have it from the Eastern Cape and the Northwest. We'll continue checking in with our reporters throughout the morning on this particular story on the phase 2 of the vaccine rollout and, of course, other stories as well.